I'm the CIO for HCA's hospitals in Denver and in the Wichita, Kansas market. HCA is a publicly traded healthcare organization based out of Nashville. It has 187 hospitals, about the same amount of surgery centers, about net revenue around $60 billion. My group of hospitals, depends how you count them, are 13, about $4.5 billion in net revenue. If Jeff Bezos was an employee of HCA or any health system, he would come in and say, why are you guys answering the phones just like you did in the 1970s? And that was our fundamental question that we asked as we looked at consolidating and automating our PBX operators across our hospitals. And reality is there's no reason to do that. I wanted to come forward with a solution that would do automation, allow consolidation to occur, and reduce the costs. And so we presented this to the CFO, and he loved it. CIOs need to come to the table with ideas to consolidate and automate and really increase the productivity of our employees. And PBX is a great way to do that. And so from a big picture, it was how do we look at our system differently? How do we consolidate and then use automation? We've offloaded well above 50% of our calls. Almost 72% of our calls now are handled by an integrated voice recognition system. And so I think healthcare CIOs need to be relentless on how do we take costs out of our health system. And this is one opportunity to do that. This went from a friendly conversation to contract to go live within 90 days. It was a proven ROI, and the ROI occurred within 90 days after that go live. We went straight to the leader, the CFO, and said, here's the ROI, and it was we reduced it by half. And so without having to do a bunch of analysis on digital transformation and all those things, we were able to go live within 90 days, and it was fantastic. So this was, I would say to my fellow peers who are interested in saying, what can I do to bring automation into healthcare to reduce costs and improve productivity and build a better culture for these frontline employees? This is a go-to solution. These PBX operators are amazing. They're the front line of our patients, families, and the physicians and the clinics that are calling into our hospitals to get services or get connected to a service or a bedroom. Increasing the productivity by decreasing the inbound calls gives them room to breathe. It allows them to have a little more relaxed conversation, listen for keywords to try to solve the problem. And they love it. It's not been seen as a threat. It's been seen as a technology productivity tool, and it's been well received. How do we take a process and a team that is answering the phones exactly the way they did in the 70s to the modern age and increase their happiness and increase the satisfaction of our customers? This is a no-brainer. I would also say, if you think about the customer segmentation, a lot of EMR systems and health systems are, pushing everyone to the portal. And that is a really good opportunity for those patients and families who like online portals and transactions that way. But remember that a large portion of our customers in health systems today are baby boomers and folks that are high utilizers, which are typically, in your 60s, 70s, and 80s, and they may not choose to use the portal as much as a different population. And so the phone is still a way in as a customer, and making it automated and giving those PBX operators room to breathe is a good thing for the customer as well. Parlance technology works. First of all, voice recognition is a proven solution. We all use Siri and Google and everything, Alexa. So I think this technology is mature, ready to go. As a CIO, if I was looking for a quick win in the budget cycle, I would do this. We were aware of Parlance through one of our network engineers, and he was advocating for it. And we've known about it, and we're finally at the end. As I said earlier, we just decided to do it across all of our hospitals rather than going to each one because there was a big win and savings there. It's worked as designed. There's been no downtime. It's been a good relationship and a great product.